Hello, everyone, and welcome. Thank you so much for joining us today. My name is Emily, and I'm the Marketing Director for Clinkscales Elder Law Practice. We are a firm with main offices here in Hays and Wichita, but we serve clients everywhere in between. We really focus on helping clients answer questions and issues regarding aging, chronic illness, long-term disabilities, and more. So we are very excited to bring you this third session today, assessing health benefits with Medicare and Medicaid. So please feel free to send any questions that you may have to us in the chat box located at the bottom of your screen. And at the very end of this presentation, we will address any of those questions that you may have. We will also have a little bit of interactivity in the middle of the session where you can respond to a question that Randy's going to ask you. Lastly, I did want to briefly mention, just to follow up from last week, in case you didn't receive our email, that we have opened up this series for free to those who wish to attend and not receive CEU credits. If you'd like to share the word with anyone, each session will be $10 for that credit. Otherwise, if you have signed up and paid and don't need those credits, we'd be happy to refund your money to you or put that as a credit towards our upcoming geriatric symposium, October 8th and 9th. So if you have any questions, please reach out to us and let us know. And without further ado, I will go ahead and introduce Nikki with KU Med's Outreach Office in Hays, and she's going to be handling your portals and all their CEU credit information. So thanks for joining us today, Nikki.
Hello, Emily. Thank you all again for joining today. As Emily said, my name is Nikki Cooper. I'm with the KU Medical Center Outreach Office here in Hays, and I'm going to be assisting with anything related to CEUs for today. I will be here the whole time, so if you happen to have a question for me, feel free to find the chat box feature and let me know what your question is and I'll get an answer for you. So the first thing I want to start with today is actually what's on your screen right now. In order to sign into today's activity and receive credit, you must enter the activity code, which is the big red letters 44BOMB. There are many different ways to enter this code in. Some of them are entered on the screen now. You can text the code to the number. You can visit www.eads.com and enter the code in. If you do have the EADS app, you can do it that way as well. Or if you're familiar with how to scan QR codes, you can do that as well. This code will expire tomorrow, September 24th at noon. You have 24 hours to do that. I will also be entering the activity code into the chat box feature of Zoom. That way, if you need to refer to it at any time during the presentation, you can access that in the chat feature. Again, this is in order to sign in today's credit and sign into today's session and receive credit. If you do not want to receive credit, we still ask that you enter the code in because this is our version of the sign-in sheet. I would also like to mention that all of the handout materials for today's session are available in your EADS portal. So once you enter this activity code in, you can visit eads.com and log in, and all of the handout materials are in there and available to you. Once you've entered the code in, it will lead you to complete the evaluation for today's session. Please complete the evaluation by October 14th. After this time, the evaluation will be closed and will no longer be available. Once you've entered the activity code and completed the evaluation, you will have full access to your CE certificate in your EADS profile. And without further ado, I will go ahead and just do a brief introduction of our speakers today. Our first speaker is Randy Clinkscales. Randy founded Clinkscales Elder Law Practice in 1985. He is a 1980 graduate of Washburn Law School and has represented clients at the administrative, county, state, and federal levels in his 30 years of practice. In 2004, Clinkscales Elder Law Practice began its elder-centered practice, focusing on issues facing our aging population, as well as the caregivers for those who are aging. Our second speaker is Joy Thomas. Joy currently oversees the Life Care Plan team at Clinkscales Elder Law Practice in Hays. She is also a benefits specialist and paralegal. She is a graduate of Friends University with a bachelor's degree in human resources management. She completed her paralegal training through the University of Southern Colorado. She worked for oil and gas law firms in a county attorney's office in Southwest Kansas, as well as a class action and personal injury law firm in Prairie Village, Kansas, before she joined Clinkscales in 2005. Our third speaker today is Glenna Clingingsmith. Glenna is currently the Information and Assistance Coordinator for the Northwest Kansas Area Agency on Aging in Hays. She provides information and assistance to callers, plans and coordinates outreach events, and she has served as the Medicare and Information and Assistance Supervisor for 20 plus years. She has been with Northwest Kansas Area Aging since 2000. Let's welcome our speakers today.
Well, Nikki's a little bit misleading. I'm not going to speak today. I'm actually here to learn from Glenna and Joy. I am Randy Clinkscales. Probably need to update my resume a little bit. I guess now this is my 40th year of practicing law this month. But I'm really honored to have Joy and Glenna here today to talk about how Medicare and Medicaid work together in providing health care particularly for people 65 and above. And Glenna's going to talk about some exceptions to that. Just a plug here, our 6th Education Geriatrics Symposium is going to be virtual on October 8th and 9th. Got some really good speakers. So you might want to put that on your calendar. Contact our office. The web address is here. And as Nikki said, we're going to provide this slideshow to you. And we're going to be going a little bit quickly here as we go along. But again, you'll get the actual slideshow as we go along. I want to ask a quick question before I get into this. How many of you feel comfortable with your knowledge of Medicare signups and coverage? And just type Y or for yes or N for no in the chat box. So, and then Emily, if you'll let me know if you get some results there. So let me start with Joy while we're waiting on that. Again, the question is, do you feel comfortable with your knowledge of Medicare sign up and coverage? Either yes or no. And then, Joy, tell us a little bit about your role in the office and just a couple sentences or so.
I'm currently doing a lot of Medicaid work and still quite a bit of follow-up on our life care plan systems and just being part of a team that makes sure our cases are being managed well, just doing the best that we can to keep our clients in the know on the latest when it comes to our government benefits, and very much appreciate people like Glenna that know more about Medicare than I do at this point. I'm definitely a lot more confident in the Medicaid area.
And let me just add that a little bit. Joy, it really helped design in our office what we call our life care plan team approach. That's where we try to help people stay at home, and we have care coordinators, and she really has been probably the most influential person in the office on designing that program that's helped hundreds of families through the aging process. Glenna, just tell us a little bit about yourself. I know Nikki said some stuff. Anything you want to add to that?
Well, I'm the SHIC Senior Health Insurance Counseling for Kansas coordinator for the 18 counties of Northwest Kansas, which is the area that the area agency covers. And right now we're gearing up and getting ready for open enrollment. So that's a lot of work.
And I know we are sending out letters to our clients right now, reminding them about open enrollment. So Emily, any responses on the question?
So it looks like mostly everyone has said no. There's one or two that said that basically, yes, the basic information, but the overwhelming response is a definite no.
Okay. So just to let you know, if I had to vote, I would be in the no category. And I have been through the process, and it was somewhat terrifying, Glenna, as I did that. And, you know, I have all this help around me in the office, and I thought I could do it myself, and I didn't do a very good job. And the bottom line is, Glenna, after I turned 65, I went for a couple months with no insurance. And accident, and all I could think was, oh no, I have no insurance.
Don't get sick, don't get sick, don't get hurt.
So, Glenna, let's kind of get into, I know you were gracious enough to provide to me some slides that were important to you. Again, our objectives today is to help recognize Medicare benefits and what's available, and identify ways to make Medicare and Medicaid work together. And so, and I've got this chart here that I think is helpful, that our participants can come back and look at later on, just comparing what Medicare covers, what Medicaid covers. We're going to get into detail on these differences as we go along. You know, one thing I would caution people, when I do a presentation like this, and the surveys that you do are really important to me, but someone's going to say we were too complicated, and someone's going to say we were too simple. So it's really kind of built in the middle of the road to give people some guidance on where they can go. We've got some resources at the end that you can take a look at. So what is
time to go into all the details?
Tell us about Medicare.
So, okay, you want me to start?
Yeah, go ahead.
Okay, well, Medicare is health insurance. It's for people 65 and over, and people under 65 that are on disability, actually drawing Social Security disability. So if you're drawing Social Security disability on the 25th month of receiving that check from Social Security, you automatically qualify for Medicare. People with ALS can qualify for Medicare with no waiting period. It's just that the disease sometimes progresses rapidly and they don't have that 24-month waiting period. And then anyone, any age that has been diagnosed with end-stage renal disease will qualify for Medicare. So, plus you have to be a U.S. citizen or lawfully present in the U.S. for 5 continuous years to qualify for Medicare. That's the basic qualifications. Original Medicare has several parts. Part A, Part B, you can add D, like the slide says, and you can also add a supplement. And as a supplement, you can either use Medicare Supplement or Medigap, or you can use like retiree insurance, or even current employee insurance, or Medicaid can be used as a supplement. Now, Medicare Advantage is also an option. You still get your Part A and B coverage. Some of the plans cover Part D, which is the drug plans, and sometimes they offer extra benefits. And they work a little bit different than original Medicare. Sometimes you could have some out-of-pocket costs that are a little lower.
So why doesn't everybody sign up for Medicare Advantage?
I'm sorry?
Why would somebody not sign up for Medicare Advantage?
It's a personal preference.
Okay.
With Medicare Advantage, you will have out-of-pocket costs. So it depends on whether you have the resources to pay those out-of-pocket costs versus buying a supplement. So it's a personal decision that when people come in, I explain both, and it's a personal decision.
So is Medicare Advantage typically cheaper premium-wise?
Premium-wise, it's less than a supplement.
Okay.
but you have nothing to supplement your Medicare Advantage plan unless you happen to be on Medicaid. Then Medicaid would pick up what your Medicare Advantage plan didn't. But if you have original Medicare, I'd say most people have a supplement that picks up what Medicare doesn't. So
And
you
just,
look at both sides.
and just so everybody knows, Glenna has no idea what kind of questions I'm going to ask her.
That's true. So he may stump me. I don't know. He might, but you never know.
All the time, Glenna.
Yeah. Part A is considered hospital insurance. So it covers you when you're inpatient in the hospital. You have to be inpatient. You can't, there are certain times you're considered outpatient, but they're required to let you know if you're either inpatient or outpatient. So it also covers you if you go to a skilled nursing facility. But you have to meet certain criteria for Medicare to pay in a skilled nursing facility. So, and when you're in the hospital, Part A covers everything except for your deductible. And every benefit period, you will have a deductible. And this year it's $1,400 and, oh, now I said that, I don't remember. $1,408, I think, is your deductible. And then Medicare picks up the rest for your hospital stay, medications and everything related to your inpatient stay.
Okay.
The next one.
Just anything you want to say about COVID here on Part A?
If you're in the hospital, from what I understand, if you have COVID, it'll cover all, well, you still have your deductible.
Mm-hmm.
Medicare will pay for everything.
Yeah.
If you're in hospital, inpatient. So,
and I was looking, apparently COVID, because of COVID, you can get a renewed time period in a skilled nursing facility without having to start a new, without having a new benefit period.
right. That's strictly because of COVID. Normally, you'd have to be out of the skilled nursing facility 60 consecutive days for it to be a new benefit period. But after that, but because of COVID, people not normally can't go home or don't have the resources, then they've waived that at this point.
Also, just everybody to be aware, there's
Yeah.
provision that if you have COVID and you can't stay at home and you need to be in skilled nursing facility, you can actually go there without the hospital stay.
You can get the qualifying event. Yeah.
Yeah. So
The nursing facilities know about this, so they're supposed to be able to do it. That's all I know. I don't know how they do it, but Part A also covers any blood that you have inpatient. Hospice is covered under Part A. Home health is covered under Part A. And inpatient care in a religious non-medical health institution. I don't think there's any in our, I know there's none in our area. As far as in Kansas, I'm not sure. I don't know of any, but it would cover you there. So, okay. Part B covers basically everything else. It's medical. So it covers your doctor's services, whether you're in or out of the hospital. Now, I think with Hayes Med, they have hospitalists, which are part of the hospital care. So that is probably covered under that. But in some of the other hospitals, that when your personal physician comes to see you, you would be billed for that visit under Part B. Anything outpatient, medical, surgical is under Part B. Lab tests, durable medical equipment, diabetic testing equipment, and supplies are covered under Part B. Preventive services, flu shot, the new COVID vaccine, when it comes out, will be covered under Part B. Home health care can be covered under Part B if you do not have Part A, and there are some people who do not have Part A. And then physical therapy, different types of therapy, and outpatient mental health is covered under Part B. So it's pretty much, if you're not in the hospital or skilled nursing or under hospice, then Part B covers just about everything else.
Okay.
So, and this is just a list of all the preventive services the Medicare covers. Some of them are not subject to the deductible and the co-insurance, which normally Medicare has a $198 deductible. Part B has a $198 annual deductible. And then once your deductible is met, Medicare pays 80% of the approved amount. So some of these are not subject to the deductible and that 20% co-insurance. Right now, I can't tell you right offhand which ones are. By looking at it, let's see, the yearly wellness visit is not, are the Welcome to Medicare. The flu shot is not subject to the deductible. I think a mammogram is not subject to the deductible and the co-insurance, but if you have a Medicare and you book, it goes through all the preventive services and it shows if they are subject to that. So
Yeah, let me just give everybody a heads up here, Glenna. When you go for your Welcome to Medicare preventive visit,
that's it's not a physical. They're going to ask you a lot of questions, and what they'll do is supposedly explain all the preventative things that you can do, and the doctor gets you signed up and everything like that. It's not a physical. Medicare does not pay for a physical. And you have a yearly wellness visit, but that's not a physical either. It's just go in and talk to your doctor, and he makes sure that you're doing your preventive things.
but I just want to give everybody a heads up. At those visits, they do perform a mini mental on you. So I would study up for that before I and be prepared, because I wasn't prepared for that. I was last time, but anyway.
Yeah, but it is something that they do pay for. It's not a physical, so.
Glenn, before we go on, I want to just real quick talk about and I know we have a slide on sign up later on, but I just want to talk a little bit about the difference between Medicare A and B sign up.
Okay, well, it's basically to sign up for Medicare when you're 65, if you're not drawing Social Security at that time, you would contact Social Security. You would either call them and make a phone appointment, or you can go to the Social Security website and enroll online. Now, if say you started drawing Social Security sometime between 62 and 65, Medicare will automatically, or Social Security will automatically enroll you in Medicare. So that's how you enroll. Now, people who are working, still employed when they turn 65, like me, you can just sign up for Part A as long as your excuse me, employer group plan is considered primary. And then you would need B, because Medicare wasn't designed as a secondary payer. So usually by the time your employer group plan has paid, then it's paid with that 80% that Medicare would have paid. So most people who are still working and their employer group plan is primary, normally we say you can sign up for A now and just decline B, or you can wait till you retire. And then with B, you can sign up later as long as you've had some type of employer group plan with no more than a 63-day gap in coverage. And then you can get B with no penalty.
And that's what I wanted to talk about, was that penalty.
Yes, as long as you do it properly, there's no penalty for Part B. Now, there are people who do have to pay a premium for Part A. And those could be the people that are on disability. Medicare Part A is free if you have contributed 40 quarters of Medicare taxes through Social Security, And then anyone who has, for some reason, has not contributed those taxes, there is a fee, monthly fee for your Medicare Part A. So there may be people who do not have Part A, but they have Part B, because the B premium this year is $144.60. If you did not have enough quarters to get Medicare A free, you may be paying, if you have less than 30 quarters, $458 a month for your Medicare Part A. So it just depends on the situation.
And let me just, a couple of things I want to point out. What Glenna said, if you don't sign up within that 63-day window, then you're going to have a penalty imposed. And the penalty is 10% per every 12 months. And so if you don't,
And it's forever.
forever.
Yes.
And that's really important, because we unfortunately have run into situations where people just did not sign up for Part B. They said, well, I'm healthy, I don't need it. And then they're now older in life, they're basically uninsurable. And so that's when we have to call Joy in, because basically they're going broke trying to pay medical bills. The other thing is that premium that you pay for Part B is really scaled based on income.
Yes.
Higher your income, that will max out in about $400 or $500 a month.
I think that's about it. Yeah. But you have to be making quite a bit to do that.
Right. So, and the point I want to leave here with Glenna before we go on is, you sign up when you need to sign up,
Right.
or you're going to end up paying a penalty forever. And whether your health insurance plan will allow you not to sign up or will force you to sign up is determined by that policy. And so I'm going to go back to my example. I was on a COBRA plan with my wife, and I didn't realize her COBRA plan, even though it was with the state of Kansas, provided that once you're 65, they would no longer cover you. They would no longer cover what Medicare would cover. So it forced me to have a few anxious months when I got that resolved.
Right.
I didn't mean to get you so off track there.
No, that's okay. It's just with Medicare, if you're still employed, it depends on the number of employees too. If there's 20 or more employees, then your employer group plan is considered primary. So less than 20, if you're turning 65, you are pretty much required to sign up for both Medicare A and B.
Right. And
if you happen to be a disabled person who's eligible for Medicare and you're covered by a spouse's employer group plan, there has to be at least 100 employees. Otherwise, Medicare will be primary. So it depends on the situation as to whether Medicare will be primary or secondary.
And again, there is another exception for COBRA plans. So regardless of what size the employer is. So again, just get really good advice. I will tell you, I had a lot of really bad advice in that process, but we finally figured it out. So.
And of course, if anybody has more questions, I'm just going over the very, very basics. So if you have more in-depth questions, feel free to give our office a call. We'll be glad to answer any questions you have.
So Glenna, what's a Medigap policy?
Well, a Medigap is insurance that you buy. It's sold by private insurance companies. And what it does is it fills in the gaps the deductibles that co-insurance that Medicare has, so that you pay a monthly premium and the supplement, your insurance policy picks up what Medicare does not pay. For A and B. It doesn't cover any drug plans, but it is something that you can add. They are federally standardized, which means if you're looking at a certain plan, there may be numerous companies offering them. They all have the same coverage, but the only difference is the name of the company and the premium that they charge. And there's a wide range of premiums within a plan, plan A through N. There's some gaps in there where there's no longer plans available, but if you're looking, say, at this point, G offers the most coverage. If you're looking at a plan G, all the companies that offer that have the same coverage. It's just that they're going to charge you a different premium. And I mean, there's a very wide range of premiums. So they're standardized except in 3 states, and they're on the screen. And in Kansas, people who qualify for Medicare due to disability can buy a supplement. Now that's not the same in all states. Kansas, if you are on disability and qualify for Medicare, you can buy a supplement. So not all states offer that. So do you need to buy one? It depends what you have. It will only work with original Medicare, and you have to have both A and B to buy a supplement. And like I said, you have other coverage. You may have coverage from an employer where Medicare is primary and your current insurance would be secondary. If you have a retiree plan, you're retired, and you have a retiree plan, then of course your retiree plan would be supplement. And sometimes Medicaid, and then Medicaid can be considered your supplement. One of the things to consider, if you don't want to buy a supplement, can you afford Medicare deductibles and copays? Medicare has deductibles. Part A has a $1,406 deductible. Plus, if you are within the same benefit period and you're there in day 60, you have $352 a day you're responsible for. And if you're there day 91 through 150, there's $704 a day that you're responsible for while you're in the hospital. Part B has a deductible. It's not much. It's $198, but you also have that 20% coinsurance. It doesn't sound like it'd be much, but if you have an outpatient surgery of some kind, your 20% could still be thousands of dollars. So that's lots of things to think about. And what do they cost? Well, I looked them up just because depending upon the supplements you buy, you can pay anywhere from about $100 up to $300 a month, depending upon which plan you pick and what company you go with. So there's a lot of information about supplements. If you're interested, you can call us, get information. The Kansas Insurance Department's website has a comparison thing where you put your age, your zip code, if you're male or female, and pull up a plan, and it will give you a list of the companies and their annual premium. That's one way to look for one and decide. You look at the cost.
Okay, one of my favorites, Part D, prescription drug coverage.
Yes, it is optional, though we do tell people it is optional, but if you do not take it when you're first eligible and you do not have other creditable coverage, you will have a penalty. So people aren't real happy about that, but it's in the laws. So
it's a forever penalty.
And yes, unless you qualify for extra help or Medicaid.
Okay.
It is through private insurance companies. They have to submit information to Medicare every year to be approved. For 2020, there were 28 drug plans. Do not know what there will be next year. Won't find that out till October 1st. And with the drug plan, you can either get a standalone through a private insurance company or the Medicare Advantage plans. Some of them have drug coverage included with them. Not all of them, but a lot of them do. So, and then some of the other, the Medicare Advantage plans. There's different types of Medicare Advantage plans. So, how does Part D work? Okay. Well, we already talked about you can choose a plan and join, and you'll have a late penalty. If the penalty is 1% of the current average premium, for every month you could have had a drug plan, but did not. So I have worked with people in the last couple of years that did not sign up when they were first eligible in 2006. So their penalty each month is approximately $50 in addition to their monthly premium. So the longer you wait, the more expensive it gets. Each of the plans have a list of drugs that they cover, and they can pick and choose which ones they want to. Certain medications are required that all the plans cover them, but for the most part, they can pick and choose. They have I don't know how many categories, but they're required to cover at least 2 in each category. Some of them will cover all, some less. And if there's any changes, this is the time of year that you will be notified of any changes. So if you use a preferred pharmacy, which means that pharmacy has a special agreement with the drug plan, you usually get lower copays than you would if you used a regular standard pharmacy. And like we were talking about earlier, if you have limited income and resources, there's extra help for Part D costs. And we do have people here in our office that can help people with the extra help applications. So if you know of anyone, just have them call our office.
Is that part of the Medicare savings program?
No, well, it is. There's 2. There's the extra help. That's for, you have to qualify for that program, your income cannot be more than 150% of poverty level and you limited resources. Now, if your income is less, you may qualify for the Medicare savings program. The income guidelines are less and the resource guidelines are less for the Medicare savings programs. With the Medicare savings programs, if your income is the poverty level or lower and you don't have very much in resources, you may qualify to have, you wouldn't need a supplement. The QMB program, you would, Medicaid would pick up what Medicare didn't. And that's the only thing Medicaid would pick up. It would help pay your Part B premium and pick up your Medicare deductibles and co-insurance. There's 2, the low income and the expanded low income Medicare savings program that covers the Part B premium only. Now, if you qualify for the Medicare savings program, you also automatically qualify for the extra help with your premium, your drug plan. So,
and there's a really good, just for everybody to know, on Medicare.gov, there's a really good explanation of those Medicare savings programs.
Right. We have everybody in our office that works with Medicare knows the income and the asset guidelines. So if anybody's interested, just give us a call. We'll be glad to answer any of that.
Yeah, we've talked a little bit about this. You will talk about the gap there a little bit.
Yes. The coverage gap. Well, most plans have, all the plans have a premium unless you qualify for the no premium. Most of the drug plans have a yearly deductible. This year, the most was $435. And then you would have either a copay or co-insurance once you met your deductible. To get to the coverage gap, as you refill your medications during the year, when the full cost of your medications reaches $4,020, not what you've paid, but what the full cost, that's when you hit the coverage gap. And in the coverage gap, you pay no more than 25% for any of your medications. Where before you may be paying a set copay, or if it's a specialty drug, up to 50%. So, and then after, if in a year you get to the catastrophic, that means between what you've paid your 25% and 95% of the full cost of your medications in the coverage gap go towards getting you to the catastrophic. Some people I've worked with have gotten to and through the catastrophic by March because they take some very, very, very expensive medications. But your normal, most of the people we see, if they hit the coverage gap, it may be later in the year. You have to be taking at least 2 to 3 expensive medications to get to the coverage gap. With some of the drug plans, your tier 1 generics have a 0 copay.
So what happens when they get to the catastrophic level?
At the catastrophic, you pay no more than 5%.
Okay.
So for most people, it drops down to not much.
Yeah.
So.
Joy, just here, while we're here on the Medicare D, can you talk a little bit about, how Medicaid looks at, some of the different drug plans? Specifically, amount of premiums that they're willing to allow coverage for.
So if you are a Medicaid recipient, the state will cover, there's a benchmark of $31.53 right now that the state will pay towards premium. And if your current plan premium's higher than that, then the excess can be deducted from your monthly patient liability or obligation that you have to pay for your care, whether you're at home or in a facility. It's encouraged, they're usually encouraged to get a plan that has a monthly premium of less than the $31.53 at this point. Does that cover what you?
Do they force them to roll into a cheaper plan during the enrollment period?
No, but it is you are required to have a Part D plan if you're going to be on Medicaid, unlike the Medicare supplement.
Okay.
This year, there's 6 drug plans that have agreed to provide the coverage at no cost if you qualify for that. So
That's great.
If you qualify, then there's 6 of them with a 0 premium. So.
Glenn, I'm going to have you, if you don't mind, just go through pretty quickly the Part C, the Medicare Advantage.
Okay. With a Medicare Advantage, it's getting your Medicare benefits through a private insurance company. It offers the same benefits that Medicare A and B provide. Sometimes they include Part D, and sometimes extra benefits. Sometimes they provide limited vision, dental. Sometimes those extra benefits have a premium. So you're still in Medicare. It's just that you don't give, when you go for services, you don't give them your Medicare card, you give them the card from your Medicare Advantage company plan. It's a little different. at first don't realize that that's what they need to do. So it's sometimes called Part C.
Okay.
Um,
I'm gonna, Glenna, just let people read this slide when they
okay.
want to
Yeah.
talk with Joy just a little bit about. Here are our open enrollment periods that we're including in this slide. Again, you can read these so that you have that in front of you. And I know we're sending notices out to our clients about these deadline dates. Joy, I want to talk to you a little bit about Medicaid for a moment, and how does this work with, we have an older client that's in the office, and they're on Medicare because of their age, but they can't pay their medical bills, or where does Medicaid come into all of this?
Medicaid, like the slide says here, is a payer of last resort. So they're going to look to your Medicare coverage, your supplemental health insurance or employment insurance. They're looking to have you pay from your private resources. And if you're on Medicaid already, that's your patient liability or patient obligation, before Medicaid's going to step in and help cover the balance. You certainly want to make sure that you have, again, your Part D plan in place if you can, and either Medicare Advantage or Medicare Supplement plan, because they're going to make you go through those payment sources first.
And I guess I want to point out something here, and I know Joy and I were talking about this the other day, because I've seen some stuff on the listserv about this, but you know, there's a real advantage to you keeping those plans in place because, you know, Joy, you know, after someone dies, Medicaid has a right to try to recoup its expenses from that person's estate. And if there's been a whole bunch of medical bills, then that could be something that they could put a lien against the home or something like that. Is that correct?
Right. It definitely helps to reduce the amount of estate recovery. A lot of times we see that, especially with people that have farm or business properties. You know, they want to do everything they can to keep that recovery amount down as much as possible. The only time that we really see where we don't want somebody to keep their Medicare supplement plan when they're on Medicaid is if we've got a community spouse that's entitled to an allocation of income and there's just not enough income there to cover what they're needing, what they're allowed to get. And so in that situation, we would recommend dropping the Medicare supplement plan, but that's really the only time that we would recommend that. We do have some people that switch from the Medicare Advantage plans to original Medicare when they go on Medicaid because of items like hospice and the out-of-pocket expenses and copays. It's just a little more paperwork sometimes, I think. But Glenna can explain more of that too if you've got more questions on that. But those are the main things. Just keep in mind that Medicaid's going to pay last.
Right. And again, that the other thing Joy, I'm trying to think of let's talk about the Medicaid assistance and how does that work?
Yeah, one of the parts of Medicaid is the medical assistance program, and it does cover a lot of the items that you see on the screen here, the medical services, dental services. There's some limits when it comes to Medicaid coverage on dental, and so you'll hear programs like 360 Care and others that are offered to people, especially that are in long-term care, to help cover things that even Medicaid won't cover. Mental health services as well, your Medicare costs, as Glenna was saying. Again, there is a limit on how much of a premium, like for Part D, that the state's going to pick up, but there are allowances for those extra expenses.
And are there resource limits, Joy, to being on what I would call medical Medicaid?
As far resources or income, they're really looking more at income than they're going to be looking at your resources when it comes to how much you need to pay out of pocket.
Okay. Versus straight Medicaid, where we've got a limit on resources and income both.
Right, for long-term care coverage, your waiver programs, and so forth.
Right. And so I think that's an important, and again, this session is a much learning session for me as it is for everybody on the call. But it's a good program, but it's got some hoops you've got to jump through. Just Joy, anything you want to talk about on this slide in terms of some of the programs that Medicaid has out there for folks?
Just want to make sure that you know that these are the different medical assistance programs that Medicaid helps pay for healthcare under. Whether it's somebody that's not meeting all the citizenship rules, or maybe somebody with higher income, somebody that's employed with disabilities, certain health issues like breast and cervical cancer, tuberculosis, and so forth. There are a lot of programs that Medicaid will help pay assistance under. So just want to make everyone aware that these are the current ones.
And I do want to, because I think there's a little bit of a misconception out there, even with people that are on Medicare, kind of go back to what Glenna was talking about, somebody that's on Social Security disability insurance claim, and they may be 40 years old and they go on Medicare. They can still qualify for Medicaid. It's based on their income, and they become what's called a dual eligible person. And so we actually do run into that more often than you would think. And so I think it's just, again, trying to coordinate all those benefits that are out there so that somebody has enough money to live on and they have health coverage. Joy, anything on this slide?
I just want to make sure that everyone understands that under the Medicaid program, it is a means tested program. You're going to have to spend down your resources to certain amounts. There are going to be some disqualifying acts when it comes to Medicaid, things like giving and even donations. If there's not a regular pattern in giving, they can disqualify you. Issues with annuities, trusts, and funeral plans that don't meet all the criteria to be Medicaid qualified, selling property for less than fair market value. There's a lot of loopholes in there that can get you in trouble. So it's really important to talk to someone before you apply for Medicaid to make sure that there isn't something that's going to keep you from qualifying, and give you an opportunity to maybe fix that before you actually apply.
And this is our resource sheet that we've included in the slideshow. The address and contact information for Northwest Kansas Area Agency on Aging. Emily, are there any questions that anyone has?
Mm-hmm. So it doesn't look like we have any questions right now. However, while I'm giving my spiel, please feel free to type those in the chat box really quickly, and we can cover those. Otherwise, please be on the lookout for that follow-up email from us here at Clinkscales. That email will include a survey link asking you to give us some feedback on our sessions today, and then also giving you some options for you to receive additional information and resources from us here at Clinkscales. The email will also include a recorded video of this presentation for you to refer back to or share with others, but please just remember that that recorded session can't be used to attain those CEUs. We appreciate your attendance today, and we look forward to seeing you next week for our session, If the Diagnosis is Dementia, by Randy and Denise Van from the Alzheimer's Association. Also, like Randy mentioned earlier, don't forget to sign up for our symposium October 8th and 9th, where you can also receive CEUs for attending our incredible sessions. And it still looks like we don't have any last minute questions. So with that, I will hand it back over to Nikki for final remarks, and then we will let you go to have a great rest of your afternoon.
Thank you everyone for attending today. I just wanted to give everyone a friendly reminder about the activity code. It is 44BOMB. It is in the chat box right now. As they flip back to that slide, it is also in the handouts. So if you need to refer to it after the session ends today, you can pull it up in your handouts as well. It expires tomorrow, September 24th at 12 p.m. That is in order to sign into today's session and receive CEUs. If you do not want to receive CEUs, we still ask that you enter that code in, as that is our version of the sign-in sheet, and it will also give you access to the evaluation, and would really like to hear your feedback. And thank you everyone for attending, and have a great rest of your day.
Glenna and Joy, again, thank you for your time and your efforts. I know this was a lot of work putting this together, and I really appreciated it very much. Thank you.
Thank you, Randy.
Thank you all. Have a great afternoon.